from the station that's on your side. This is Channel 7 News Daybreak.
Welcome back. It is 6:24 and it's almost February, which means Heart Awareness Month. You may be surprised to know that 80 million Americans aged 20 or older, that is 1 in 3 adults, have high blood pressure. It's a very dangerous condition, but the good news is that you can do something about it. And joining us this morning to get you heart healthy is Baptist Health's Dr. John Allen Cockerell with Sherwood Family Medical Clinic. Good morning. Congratulations on being a dad for the second time.
Yeah, thank you so much. I appreciate it. Yes,
she's just
absolutely.
13 days old, so you're getting sleep when you can, right?
Trying to, yeah, as much as we can.
Well,
yeah.
let's talk about Heart Awareness Month. It is a good time to really start talking about high blood pressure and taking care of your heart. First off, let's talk about what actually counts as high blood pressure. Yeah,
so a lot of misconception here, I think, from my patient experience. So 140/90, that's the number to keep in mind. Okay. Understanding what it's not is very important too, because it's not a one-time read, right? I have patients come into Sherwood, my clinic, and say, "Doc, my blood pressure was high the other day." It's not a one-time read that can be influenced by anxiety or working out or even being at the doctor's office, you know?
Sure.
Not the one time, it's the trend. So JNC8 is the Blood Pressure Council in charge of research, you know, and talking about management of blood pressure. They recommend the diagnosis be 140/90 on multiple different occasions. That's treatable hypertension.
Okay, so tell us what high blood pressure does to our bodies.
Sure, lots of different things. I mean, the blood pressure is involved with the blood vessels, obviously, and there's blood vessels all throughout the body. So you're looking at things all the way from heart attack, stroke, some of the common manifestations that we think of, right? All the way down to the microvasculature, the very small vessels. So things like the eye, the nervous system, you know, the brain. Multiple different things can be affected, the kidney, the portal system of the liver. So really controlling the blood pressure really takes pressure off the entire body.
Most of us walk around without thinking about our blood pressure. At what age do you need to start checking your blood pressure?
So 18 plus is the USPSTF recommendation. Pediatrics have their own set of guidelines as well for checking blood pressure, but really, you know, we start checking in adolescence, early adulthood. 18 plus is when we start.
And if you do have high blood pressure, talk about the treatments available.
So a couple things medically and then non-medical too. And I know we're kind of up against time here, but medically there are several medications that can help treat, and it's not darts at a wall. So I tell patients in Sherwood, it's not, hey, well, let's try this and see what happens. No, it's more than that. There's more science behind it than that. So we know what works in terms of medications. Most are affordable and very well studied, very few side effects. On the non-medicinal side, right, stopping smoking, diet, exercise. I know it's easier said than done. The DASH diet, D-A-S-H, becomes very important. You can look that up at home. But that's a great dieting plan. Also making sure we don't have something underlying the blood pressure like sleep apnea, something like that.
Gotcha. The important thing is see your doctor, have it checked so you know what your blood pressure is. Dr. Cockerell, thanks so much. As always, if you have a question, you can always call the Baptist Health Helpline at 1-888-BAPTIST.